It says I'm a fighter, and then on 6/14/10, which is the day that I got cancer. Probably started in May of 2010, I believe, and I was just getting these random bruises like all over my body, and so I would Google like just random bruises, and the first thing to pop up was like leukemia. So, like, of course, I like told my mom. I was like, "Mom, I think I have leukemia," and she was like, "Well, if you really are afraid, like, schedule an appointment." And I never did because I just was just like, that's just my like hypochondriac like kicking in. And one day I was at work and my like thighs were just started to like ache. And when I got home, I was telling my mom, and she was like, "Just take some Tylenol and just go to bed." When we woke in the morning, they still like were killing me. So I told her to take my temperature, and it was like 102 or something like that. So she gave me some Tylenol, and we just like slept it off, and it went down a little bit, like to 101, and then by 5 o'clock, it had jumped to like 105. So my mom was like, "We need to go to the hospital." So my mom rushed me over to here, to Wake Forest, and I just I don't remember much of it, but they ran a bunch of tests. They took X-rays and stuff, and I like had passed out because I'd gone into respiratory like distress. Immediately, my body just like started to like shut down. The next day when I woke up, the doctor walked in and said, "You have leukemia." I was put into the ICU and I was in a coma.
His outcome was quite a pleasant surprise that he survived all this. He had so many things going on. Within 4 days of being here, he already had bleeding into his brain, was really unresponsive to any of us. Within a couple of weeks, he had renal failure, was on dialysis. He had high fevers and infection from day one. He was on multiple drugs to try to keep his blood pressure up. He had the bleeding abnormality, clotting abnormality. His liver failed, ended his bilirubin, which is a measure of liver failure, was more than 12 times normal within a couple of weeks. One of the keys of a medical center like this is to have all the key people working together. You have your critical care doctors working with the disease-focused people like our leukemia doctors, infectious disease doctors. But then later in his course, as he developed renal failure, he had the nephrologist involved, neurologists were involved as he had bleeding into his brain. So he had lots of complications, had a huge team of people working together, but all with one common mission, which was to help this young man try to survive this devastating illness.
They told my parents, they were like, "We don't know if he's going to make it because everything is just not looking in his favor." And my aunt said this prayer that my grandma used to say, and then the next day I woke up and I wasn't fine, but they said like he's gonna pull through.
An important part of Ryan's success is related to the early use of arsenic trioxide. It's a drug that has much less toxicity than our standard chemotherapy drugs, so we're able to give it to him with all of his problems with liver failure and kidney failure. It's also a very effective drug, does not have very many side effects, so we're able to incorporate it into his treatment after he was in remission to try to maintain that remission. The outcomes are quite good in patients who receive that drug. Of the ones who receive it, less than 5% will relapse over time. And so it appears to be curative in those patients. No one that received that drug has relapsed more than 3 years out. Being part of a comprehensive cancer center is what allows us to incorporate these kinds of treatments, bring these new treatments to patients, and treat each patient on an individual basis. We can take what we learn from our clinical research trials, what we know from our laboratories, and we can incorporate as soon as it's safe into patient care. So we extrapolated from what we had learned from this clinical trial and adapted it to Ryan's care with an approved drug, but using it slightly differently to help minimize toxicity and help him be able to survive his disease.
Since I had so many other problems that related to the cancer, I had to go to the stick center, and they were amazing therapists who like didn't let me like just like be sorry for myself and like lay in bed, and who actually like were like, "You have to get up and you have to work." I went to comp rehab, and that's where I did my physical therapy after the stick center, and I worked with a doctor named Kelly, and she was awesome, and she got my hand to start working again and taught me how to type again. Nurses here are amazing. Their care is so great, and they had to do things that like was extremely embarrassing for me, just being like a 24-year-old and like feeling like hopeless, and they were just always there and always supportive.
It's pretty phenomenal what was accomplished here. The reward is seeing a young man who's back to living life. He's actually thinking of moving forward with a kidney transplant if we can find an appropriate donor. But to look back at things, you realize that a lot of people were doing their job and doing it well from day one. And all those people working together on a day-to-day basis, doing their job and doing it well, he was able to survive this. And the reward is quite impressive, as you can see.
I couldn't have done anything without my mom, who would go to work and then come to the hospital and stay until midnight and then like leave for work and then come every single day. I was in a coma even when I was awake. That's like her goal was, work my son.